This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan. Hey beautiful soul, it's Jacqueline from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to our channel and please keep on watching. And if you have a friend or family member or loved one with lichen sclerosus, and you want to learn more about the mental and physical health aspects of living with lichen sclerosus so that you can better support them in their journey, then please subscribe to this channel as well and please share it with them. Okay, so in today's video, we are continuing the conversation about sexual health and lichen sclerosus. Specifically, we are going to be talking about pain with sex, and I'm going to share my top 10 tips for managing pain with sex. Now, to be perfectly transparent with you, these are not recommendations that come from any medical studies or any scientific literature. I am sharing this strictly from my lived experience, from what I have learned as a patient living with lichen sclerosus whose main symptom was pain with sex and tearing with sex. So that's where this is coming from, just to be completely transparent. If you have tips that help you manage pain with sex and I didn't mention them, please, if you feel comfortable, share them in the comment section below. I love learning from my community, and I love when we kind of learn and grow together. It's this beautiful relationship that helps propel us, forward towards, healing. So please don't be shy. If you feel comfortable, please share your tips. If you try out any of these tips and they are helpful, please come back and let us know. And with that, as always, if you find the information in this video helpful, then please leave us a thumbs up, a like, and please subscribe. So my first tip for managing pain with sex is to see and work with a pelvic floor physical therapist or pelvic floor physiotherapist. They might be called different things depending on where you live, but essentially they are trained therapists whose main focus is the pelvic floor and pelvic health. Now, these therapists are trained to do and support people with a number of pelvic floor conditions, including, but of course not limited to, urinary incontinence, urinary frequency and urgency, constipation, bowel issues, hemorrhoids, anal fissures, stuff like that. They can also help with all the different processes of pregnancy and birth. And they also are very well trained in treating and managing pain with sex, whether it be from lichen sclerosus or something else. This is something that they commonly see in their day-to-day practice. One of the first things I did after being diagnosed with lichen sclerosus was actually to go get a pelvic floor physical therapist. I was lucky in that I was already part of a clinic, a rehab clinic, because I do have degenerative disc disease in my spine, and so I do frequent kind of a clinic where they have rehab and massage therapy and chiropractors and pelvic floor physical therapists, etc. So I already kind of had a place, and so I booked in, and that experience was absolutely phenomenal. So for folks that don't know, if you go see a pelvic floor physical therapist, your first appointment is going to be them taking your medical history, listening to your symptoms, etc. And then they might do a kind of physical assessment. So by that, this one kind of blew my mind at first. So I mean like head to toe assessment. At first when she said physical assessment, I thought we were going straight to the pelvic floor, straight to the vulva. Oh no, she was checking my neck, my head, my posture. She was looking at my feet. And I was like, why is she looking at my feet? For a split second, I started like panicking in my head thinking, I think I booked the wrong kind of therapist, because I want to talk about pain with sex and she was down there looking at my feet. What do my feet have to do with sex? Well, they actually do sometimes have something to do with it, but that's a different topic. So they are very whole body approach. So they will do a full assessment of how you walk, your stance, your posture, etc. And then they'll move into an internal exam. You are never obligated to do an internal exam, by the way. They will always ask for your consent, and they will always explain exactly what they're going to do before they do anything. And it is always your right to decline. And it is also your right mid-internal exam to say, hey, I think we're going to end it here. I don't feel comfortable. This hurts too much. Please, let's stop this. That is your right to do at any point. So next step was, they do an internal exam, which includes just one finger, gloved. They put lubricant, and then they're going to insert that very slowly into the vagina. And what they're doing is they're kind of evaluating the tissue and the muscles. So they're looking at the pelvic floor muscles. Are they tight? Do you have trigger points? They're kind of getting an idea of what's going on. They will also do an external exam that's going to be looking at the vulvar tissue. They might check your clitoral hood to see how scarred it is, if there's any scarring, is it mobile, is it not? So they'll do a bunch of those assessments, and based on that and your symptoms, they start putting together a clinical picture, and then they're going to talk to you about your goals. Now for me, my goal was obviously to not have pain with sex. So for me, I experienced tearing with sex, but I also had a lot of burning. So my vulva and my vagina, both of them would be burning. Now I learned later that the internal burning in the vagina that I was feeling was not lichen sclerosus. It was super tight pelvic floor muscles. If you want to learn more on how tight muscles in the pelvic floor can contribute to pain with sex and how you can help overcome that, check out a video that we did with Dr. Mukta Chauhan on overactive pelvic floor pain with sex. We're going to leave a card up here, and I will also leave a link to that video in the description box below. But yeah, so I had a lot of tearing, pain, discomfort, and a lot of that burning during sex and after sex. So it was very clear that I was looking for ways to hopefully overcome that, or at minimum kind of reduce that burning sensation. So I told her my goals, and then she kind of put together a plan, and we worked on that. So that's kind of how it will look for you. So, be clear about the type of pain you experience, when you experience it, and what you're kind of looking to get out of these sessions. Where do you want to be, say, in 6 to 12 weeks? What is your end game? What are you looking for? Be very clear. And then based on all of that, they're going to help put together a plan to help get you to that goal. Now, how they get you there is going to look different for everybody. For some folks, it involves dilators. For some folks, it involves pelvic floor wands. For some folks, it's really just learning and teaching them how to release the pelvic floor, how to relax the pelvic floor. For others, still, there might be some internal work that they are going to do. It really, really depends, but they can be a really great source of help to, helping you overcome the painful aspect of sex. Tip number 2 is to do a pelvic floor meditation before sex. So yes, you've probably heard of meditations before. You've probably done a couple before. But there are meditations that focus just on the pelvic floor and focusing on moving you through a guided, gentle, slow practice to get you to kind of release some tension and open up space down there. I find this really helpful as somebody that has a tendency to lock up down there and to get really tense. So sometimes when I feel that I'm maybe more tense than usual, I will sometimes do one of those practices before I have sex, just to kind of get my body to settle, to get things to calm down, and to get some muscles to kind of, go from this to soft. Now, there's tons of ways that you can do pelvic floor meditations. One way is you can join the Pelvic Health Yoga membership. I will leave details for that in the description box below. There are pelvic floor meditations in that membership, as well as other things. If you're not looking for a membership and you just really want a quick go-to video, I highly recommend actually one of my pelvic floor physical therapists. She has a YouTube channel, and she has tons of pelvic floor meditations that you can pick and choose from. Her channel is Body Scan by Jane. And again, I will link that in the description box below. That's on YouTube. So again, you can just kind of put it in your phone and close your eyes and just listen to her voice and kind of go through that meditation. What I love about Jane's channel is that it is super focused on the pelvic floor, but it's also very mindful of folks who don't have a lot of time. So she has some meditations that are just 3 minutes, 5 minutes. So these are really great for folks that don't have, 45 minutes to lie down or recline somewhere and do a meditation, right? It's very much geared for folks that have a busy schedule, have a bunch of little kiddos running around the house, or have to run to work and do this. So these can be shorter ones. And then she does have longer ones too. So there's a lot of diversity for you to kind of pick and choose. So check that out. Try out a couple, see which one works for you. I kind of have like 3 go-tos that those are the main ones that I do. And then every now and then I'll kind of switch things up. Alternatively, you can also try, different meditation apps might have some pelvic floor meditations that you can try, or you could just maybe do a body scan, right? It doesn't need to specifically be pelvic floor. I just personally find that I benefit from the pelvic floor guidance, but a full body scan meditation might be great too, or even just closing your eyes and doing some deep diaphragmatic breathing before. I find it's really helpful to get us to calm our nervous system and to get our muscles to kind of relax, which is ideal before sex, right? Because if our nervous system is tense and we're tense, it's probably gonna be painful and it might increase our pain. So it's kind of making things worse, where we want to stack the cards in our favor. We want to kind of align ourselves up to have the least amount of pain possible. So explore different meditations, find what works for you. We all have different preferences when it comes to meditation. Some people like a specific kind of voice. Some people don't like when there's voices and they just want to hear soothing music, or there's all types of things, right? Find what works for you and run with that. Tip number 3, use a warm compress. Use warm heat therapy. This one might sound a little strange, but stay with me for a second. We're kind of building on tip number 2 here. So we're building on that idea of relaxing the muscles in that pelvic area. So in that pelvic floor area with the vulva, vagina, we're trying to get everything to kind of be soft and relaxed. So what I actually use private packs for this. So here is my private pack. It's already in the protective sleeve. So I'm going to take it out. Whoop. So that's my private pack. These can be put in the freezer to make it into a vulvar ice pack, or you can heat these too. So to heat your private pack, you can either put it in the microwave. I think it's like 5 to 10 seconds, but everybody's microwaves are different. So I say when you're doing it for the first time, maybe even like 3 seconds, test it out, and then small incremental little bumps until you find the right temperature. If you don't have a microwave or you don't want to use a microwave, another thing that you can do is you can take like a big bowl and fill it up with hot water, and then just submerge the private pack in that hot water, leave it there for a few minutes. So now it's going to become warm. Then after, you can put it back in that protective sleeve. That's always just so that we're protecting the skin, whether it's ice or whether it's heat. We want a protective layer there so that we're not damaging or risking any damage to the tissue. So what I like to do is I take that warm compress and I rest it against the vulvar area, because that heat helps increase blood flow to that area, which is great for sexual activity, but it also helps relax muscles, right? A lot of time, if you get a massage or something, they'll end by putting a heat pack on, because heat is really great for relaxing the muscles. So if you have a hard time letting go of that tension, that heat pack can be an extra kind of little helper to get things to kind of settle down there. So I really like to do that. You don't have to get private packs. You can get a different brand or something else, or maybe you already have some kind of heat pack and that works well. What I like to do is I like to just stick it there, and then I do my meditation. So I let the heat kind of do its magic, and then at the same time I close my eyes and I imagine all of my muscles letting go, and I imagine things opening up, and I really try to get myself in that safe space where I am relaxed. And that's the space that I want to be when I'm about to be sexually active. I don't want to be tense and anxious and everything is clamped up. So we're working on opening up. So I find that can be a really helpful way to get things to relax. If you are interested in getting private packs, I do have a discount code. I will leave the link to private packs in the description box below. And then you can use my code, all capitals, the Lost Labia Chronicles, to get 15% off of your first order. Tip number 4 is to masturbate first. Okay, I know that might be a little bit strange, but again, stay with me. So sometimes it can be easier for us to get into that kind of sexual headspace when we are alone. And after you've kind of warmed yourself up, your body is more aroused, more receptive, and it can make things less painful because you're already well lubricated, you're already aroused, and you're already kind of primed for it. You can masturbate alone. You can masturbate with your partner or partners in the room. Maybe do some mutual masturbation. Maybe use a toy to kind of warm up. That's another thing. So you can use a vibrator or any other kind of toy that you find is pleasurable. So using those can kind of already just get you in the mood, and again, just make things a little bit more relaxed and safe moving into things, so that you're not going from like 0 to 100. Instead, we're kind of gradually working our way in. If you know me, you know I love my baby steps. You know that I'm not a good fan of rushing into anything. That's just not how me and my anxiety brain work. So play around with that as a form of intimacy with yourself and or with your partner or partners. Again, this can be alone, and then you invite your partner or partners in, or you do it together, mutual masturbation, or you have them use a toy on you or anything like that. Really just kind of experiment and see how that works for you. Tip number 5 is to use a lot of lube, but also to double up on protection if you experience pain or tearing around the vaginal opening. So here's my vulva puppet from the Body Agency. So these bigger outer kind of purple cushion, that is your labia majora, the outer lips. Then we have the inner lips here, that's this crimson color. Up at the top we have the clitoral hood, and then underneath that hood we have this pink circle here, that is the clitoral glands. This white area here is the vestibule. So around the top of the vestibule, but underneath the clitoral glands, you'll have your urethral opening, and then towards the base you're going to have the vaginal opening. So a lot of folks that experience pain with sex will experience pain around the vaginal opening and the fourchette kind of perineum area. So what we often suggest is that if you experience pain there, to put a barrier cream on first. So before you put any lube, use a barrier cream. So a barrier cream is it's a thick ointment. So think something like Vaseline or Aquaphor. Of course, caveat with Aquaphor, if you have a known lanolin allergy, do not use that product because you will have a full-blown allergic reaction on the vulva, which you do not want to experience. If you don't know if you have a lanolin allergy, just test a small amount of Aquaphor first. Do a little patch test. Maybe take a small amount of lanolin Aquaphor, and maybe put it on just a small area of the labia majora, and then wait and see a couple days, make sure there's no reaction. I have a full detailed blog on how to patch test your products. I will leave that linked in the description box below for you to check out. But yes, so the double protection would be that you put a barrier cream on the area that tends to tear or where you're worried about tearing. And then over top of that barrier, then you're gonna add a copious, nice amount of lube. This is my favorite lube. It is Slippery Stuff. It is a water-based lubricant. I tend to go with water-based because I use a lot of toys, and a lot of my toys are silicone, and silicone toys are not compatible with silicone lube. If you are a silicone fan and you do not need to worry about toys, you can use something like Uberlube is another really good one. People love this one if you want silicone. But again, because I use a lot of toys, I stick to water-based, and Slippery Stuff is by far my favorite. It is the lube that most PTs use that I know of. Most physical therapists use and recommend this one. It comes highly recommended for folks who have kind of vulvar skin conditions. So that's what I use. So barrier cream and then a ton of lube. I am definitely not shy with the lube. Like, I will and like really go hard with it. And that's fine. I have no shame. I will definitely apply a lot of lube because it helps me mentally. And when I do that double protection thing that I do sometimes, it also helps me mentally feel a little bit like there's extra protection, almost like I've got 2 layers now of protection. And again, it's not foolproof, but it definitely can help some people. So might be worth a shot to explore. Tip number 6 is when you're cleaning up after you've had sex, use something like a peri bottle to clean the vulvar area. So this is my peri bottle that I have. It's by Frida. I'm not sure how you pronounce that. Frida. That's the one I have. I love this one. I bring it with me when I travel, so you can put that down, put it in your travel bag. So this fills with water, and then you pull this out. And I don't know if you can see, but it has these little dots. So if I squeeze, it squirts out a gentle stream of water. So that can be a really nice, gentle way to kind of clean off that area, clean off any lube or anything else that's there. It's way more gentle than kind of taking a cloth and aggressively scraping things off or using toilet paper. I like a really gentle way of kind of cleaning up after. And I find that peri bottles are the best. If you are somebody that experiences stinging or burning after sex, and especially when you urinate after sex for the first few times, or even the first few days if you're me, then again, this can be a really nice way to clean after urinating. So once you're done urinating, you're again just gonna squeeze gently and use that water to clean off any excess urine. Also, if you experience burning or stinging when you pee, you can also strategically aim this nozzle and kind of press it while you are urinating so that the water is kind of hitting the urine and diluting it so that the urine isn't as strong and it might not sting as much. So you can kind of play around with that, both with respect to cleaning up, and also if you're someone like me who will often have stinging and burning after when I pee. Sometimes it would even be like for the full week after I would have sex that I would have that burning and stinging. So this was definitely my best friend. Tip number 7 is to use an ice pack if you are sore. So I spoke to you about how I would often burn or experience stinging when I would urinate after sex, but another thing that I would sometimes have is just general soreness, like almost like it would feel like my whole vulva was inflamed and just very, very sensitive and sore. And so what I like to do for that, and if there's soreness or burning, is again, I used my private pack. And for this one, I'm going to use one that's been in the freezer. So after I will clean up with the peri bottle, and then I will use one of these private packs. I will apply it again with the protective sleeve. And then I will lie that against the vulva and I will just kind of lie down in bed. I might even do another meditation to kind of just, again, get my nervous system to calm down. And I really let that ice kind of work to soothe any burning, any stinging that I'm feeling, and really kind of help bring inflammation down. I find that to be very, very helpful whenever there is that soreness or that burning after. So again, I typically have like 3 to 4 of these in my freezer at all times, and then I have a couple that I just kind of leave out for heating purposes. So sometimes I'll do 20 minutes with one, and then that one's no longer cold, and then I might go get another one if I want to do a little bit more later. So kind of play around with that cold therapy to kind of help with the burning and the soreness that you may experience after sex. Tip number 8 is to use a soothing emollient afterwards. So after you've done cleaning everything off and after you've used some ice, then I like to apply a really nice soothing emollient to the area. Now, everybody is going to have a difference of opinions on which emollient is the best. And the truth is there is no emollient that is the best. The best emollient is the one that feels soothing and good for you and your body. We all have different preferences, and that is a-okay. Now, there are a lot of emollients on the market. I do have a couple of videos on emollients. I talk about what they are. I also do an emollient review video, which I'm gonna do a second one because I have since experienced and tried a lot more products that I really want to share with you. So I've got another one of those videos coming up in the future. I will leave a card up here, and again, those links will be in the description box below if you want to check that out. So your emollient, again, it could be coconut oil, it might be V Magic, it could be Sweet Spot Labs Rescue Balm. That can be really nice after, especially if there are any tears. That's a great product to put on after. Another product that I have been obsessed with lately is called FemSense Balm. And this comes from a pelvic floor PT that makes this. I don't know if we can, I'm trying to do like the makeup thing where you can see it. But anyways, I'll put a picture out later. This balm, chef's kiss. It is so like buttery and soothing. The consistency is beautiful. It's like in between a thick emollient like Vaseline and something really, really thin like coconut oil. It's just got this beautiful consistency, and it is so soothing, so hydrating. I love the ingredients. And so this is what I've been using lately. I cannot rave about this product anymore. It is just my absolute favorite. So I like to apply that after I've iced and after I've cleaned off. I like to apply a nice amount of emollient to that area, again, to just add some more soothing kind of feelings to that area. Again, choose whichever product you want. There's no wrong or right product. You choose what is right for you, but that can be a really nice thing to kind of add on after you've done that. Tip number 9 is to wear loose-fitting clothing and underwear after you've had sex. So if your vulva, pelvis, and vagina, if that's all burning and irritated, if you are feeling really, really sore, the idea of putting on like skin-tight leggings or super tight jeans may not sound the most appealing. That kind of friction and rubbing, not exactly the vibe we're going for, right? We really want to show that area a lot of softness and gentleness. So that's what we're trying to do. So I like to wear really loose underwear. If you know me, I always talk about sizing up. So if my regular underwear size was like a medium, I will get an extra large because I want like extra area, extra space, in that kind of gusset area, that area that kind of hugs the vulva. I want some space there. I don't want that fabric rubbing up directly against the vulva. When my vulva is already irritated, I don't want anything rubbing up against it. So I will either go commando or wear loose underwear, and then I'll have really nice, soft kind of lounge pants that I will wear. They're very baggy, very comfortable. Again, I'm just trying to avoid friction the first day or so after if I'm experiencing pain, soreness, burning. I'm just trying to, again, take out all of the elements that could potentially be aggravating or making those symptoms worse. So assuming I don't have something to go do that involves super tight clothing, I try to keep it to really baggy, loose, comfortable clothing afterwards. And finally, tip number 10 is that if you are struggling from the mental health aspect of the physical pain that you're experiencing, I recommend to talk to somebody about this. Ideally, it would be a therapist or a counselor, some kind of licensed professional that can really help navigate those mental health challenges. But if not, even talking to a friend about it or writing in a support group saying, hey, you know, this pain with sex, it's driving me nuts. I feel like, you know, I'm broken, and whatever thoughts are going through your head, you can share that in a support group forum online. You can also come to LSSN's free virtual support meetings, which is hosted by myself and Kathy. We host those every other Saturday, and that's a space where, you know, you can kind of share what you're going through and what you're struggling with. And we're not licensed professionals, and we might not be able to kind of give you that kind of support, but at least we can help you feel heard in your struggle, and other folks can kind of chime in the chat and kind of, you know, send you love and tell you that they struggle too and you're not alone. So you want to just make sure that you're always like looking out for your own mental health, because while sexual pain, yeah, it really hurts, it can really destroy us mentally. So at the end of the day, whenever I'm talking about tips for managing sexual pain, I always want to end with addressing the mental health piece and making sure that you are getting support in some way, shape, or form. I understand that therapist is not, accessible to everybody, both for financial reasons, maybe accessibility reasons. And if that's the case, lean on your support groups. They can't replace a licensed professional, but at least it's a space where you can talk freely about what's going on and what you're struggling with. And sometimes it can really help to know that you're not alone in that there are other people that are going through this too. Sometimes that can be really, really healing. So always, look out for your mental health. All right, so that concludes my 10 tips to help manage pain with sex from lichen sclerosus. If you found these tips helpful, please give this video a like. If you want to share your tips, again, I super encourage you to do so. I love learning from the community and I love when we learn from each other. So please, please, please feel free to share what works for you in the comment section. If you find these videos from Lichen Sclerosus Support Network helpful and you want to give back, you are always welcome to leave a donation, which you can do on our website, or you can volunteer for our nonprofit organization. These are two really great ways to help ensure that we can keep providing these free videos and free blogs and free education programs to the community. And that is it for this video. I will catch you in the next one.